Hi there, my name's Josh Bennett and I'm a final year PhD student at Newcastle University in the UK, and I'm also a medical doctor training in paediatric rheumatology. And it's my pleasure to talk briefly today about sarcopenia in RA as part of this month's theme, Hard Decisions in RA. And the things that I really want to stress about sarcopenia in RA, or rheumatoid sarcopenia, I'll call it, is that it's common. It can be tricky to diagnose and recognize. And finally, the best thing that you can do for your patients with RA who are sarcopenic is to try and encourage them to increase their physical activity if possible. So firstly, what is sarcopenia? Well, it can be thought of as the generalized and accelerated loss of muscle mass and function. Now, typically, this is associated with older age, but chronic diseases like RA can result in sarcopenia manifesting at a younger age. And the problem with sarcopenia is that it increases the risks of falls, frailty, and mortality, and it causes functional decline. So people are essentially less able to live independently than they would otherwise be. And in RA, sarcopenia is common. We think about 1 in 4 people with RA affected. And there's probably lots of different reasons for this. Of course, high levels of systemic inflammation are often present in RA, and that can lead to increased muscle protein breakdown. Also, some people with RA aren't able to do as much physical activity as others, and there's less stimulation for muscle protein synthesis. And finally, there are iatrogenic effects to bear in mind, so steroids being a good example of that. So how do you recognize rheumatoid sarcopenia? Well, people come in all shapes and sizes, and people with RA who are overweight or obese can still have low muscle mass, but that might be a bit more tricky to recognize compared to your individuals who are cachectic and have a very low BMI. So that's one obvious difficulty. And I think another thing that you'll all be aware of is that measuring muscle strength in someone with inflamed joints or damaged joints is wrought with challenges. So grip strength is a common muscle strength test, but of course, many people with RA might have difficulty with that if they've got inflamed joints in their hands and wrists, or indeed damage. And how do we diagnose sarcopenia? Well, the second European Working Group on sarcopenia in older people have some recommendations which are helpful. And they essentially suggest that if you diagnose low muscle strength, of course, after excluding other causes of a low result, such as arthritis or neurological problems. Anyway, low muscle strength is enough to diagnose probable sarcopenia, and then you can then use that diagnosis to institute an appropriate management plan. You can also then go on to confirm sarcopenia by measuring muscle mass, typically with whole body DEXA. So finally, what can you do to help your patients with sarcopenia? And here, exercise is the best medicine. So resistance exercise has a really good evidence base for improving both muscle mass and strength. And that's in the context of RA as well. There's also evidence to say that other forms of exercise are beneficial. If your patient is unable to lift weights for whatever reason, then aerobic exercises like walking, running, swimming, and cycling are still effective ways of improving their muscle health. It's useful to look for vitamin D deficiency because that can have an impact, and so replacing vitamin D where appropriate is useful. And finally, for drug treatments for sarcopenia, there isn't really anything at this point in time. Studies have considered the effects of DMARDs on sarcopenia, and the results are mixed at the moment. A few studies have shown positive effects, but recent systematic reviews and meta-analyses have found that really there's no overall effect. So we'll watch this space as more studies come out, I guess. So thanks for listening. If you'd like more detail from this video, you can look at a review on rheumatoid sarcopenia that we published in Nature Reviews Rheumatology earlier this year. And I hope that this video has helped you to consider which of your patients with RA may be sarcopenic, and also just to figure out how you can start to help them.